Welcome back to the Nosco Unpacked podcast. This is Craig Curran. Join me as I chat with a great colleague and friend of mine, Dr. John Whyte. John is Chief Medical Officer at WebMD, and we're going to talk about the future of AI and healthcare live from our mastermind. Can I have your permission to start using augmented
You
intelligence?
may indeed.
Because
I'm not the first person that came up with that.
We need to make that
Yeah.
a real trend when we're talking about this in the healthcare space,
Yeah.
because I don't like the word artificial either when it comes to healthcare. And I think, you talking about that today was pretty meaningful to me. You also talked about physicians are getting increasingly confident in AI. I think you cited, 68% now support AI.
Mhm.
What's causing the increase in confidence that you're seeing?
And Craig, that's a big change. That would not have been the case a year ago. And 2 years ago, it probably would have been almost the exact opposite.
Wow.
I think part of it is physicians are getting more experience with it. They're utilizing it more. There's this concept, as I mentioned, called an AI scribe, where it'll transcribe a note for you so you don't have to be typing at the keyboard. And I think they've had experience learning how it can help with diagnosis,
Mm.
particularly in this radiology space and the urgent care space. So they're having more familiarity with it and they're more engaged with it. And they're seeing some of the positive outcomes. And as we relate to the discussions of augmented intelligence, they're more comfortable with that approach.
Boy, you really struck me when you put the slide up there about AI cancer diagnosis. And I think it was like 244 to
Yeah.
201
Hmm.
that the actual AI assisted better
Yeah.
in finding cancer than without AI support. Can you elaborate on that a little bit?
And Craig, that's what I'm most excited about in the field of oncology and cancer. Much of medicine is about pattern recognition. And that's why we're seeing such good results in studies that relate to radiography in terms of mammograms or CT scans and cancer. Because a supercomputer, an AI tool, can recognize patterns more than the human eye can do that. And, my vision would be that everyone that has a cancer diagnosis has a second opinion driven by AI. We may not be there yet, but we're getting close. And if I go to a clinic, a medical center, or hospital, an oncologist, I think we're going to get it to a point to want to know, are they using AI in the diagnostic strategy? Because time and time again in studies, we're seeing more cancer diagnoses picked up.
Mm-hmm. Right.
And let's be honest, physicians make mistakes too. The worst mistake I would argue in cancer is to be told you don't have cancer when you do.
Yep.
I mean, it's also bad when you're told you have cancer and you don't. That doesn't happen as much as you don't have cancer and you actually do. So if we can reduce that burden, that error by utilizing AI, and that's what we're seeing because it's really pattern recognition and imaging or biopsy or the use of biomarkers, that's a great advancement.
You were talking about a lot of tools that are out there
Yeah.
now too for diagnosis using AI, and one of them was the AirPods Pro 2.
Yeah.
Can you tell our audience a little bit about what that's doing?
Yeah. The AirPods Pro 2 have a feature now that's been cleared by the FDA to check for hearing loss. And we know that hearing loss increases the risk of dementia, right? It increases loneliness. People don't want to go out when they have hearing loss. People don't want to go to the doctor to be told they have hearing loss.
Mhm.
But if I could do a test at home to check my own hearing or a loved one's hearing, that's pretty good. And that's this whole concept of bringing care to the patient. So, I don't have any stock in anything that we're talking about today, but I've utilized it and I think it's pretty cool. And it's something that folks can check out on their own. And there's going to be more of those types of tools.
Well, that one hit close to home for me because, my wife always,
Yeah.
complains that she's
Hmm.
having hearing loss now, but she doesn't want to go to the
Okay.
doctor to check it out. So I'm like, I think I'm going to say,
Yeah.
Kelly, maybe
Yeah.
we should check your hearing using this.
Just put these in your ears, and I'm gonna do a little test, and let me know how it goes. But
She might be losing her hearing. Yeah, she doesn't listen to me.
well, there you go. That's natural, but it'll pop up on your screen on your phone, and folks really should check that out.
You also talked a lot today about the different ways people are getting their healthcare information, and it's not all with Google, right? It's using
Right.
chatbots and
Mhm.
other means, and you talked about that's changing, right? About how they're doing their searches.
Absolutely. People are not going to the same degree of putting something in, the search box on Google and then ending up at a page like WebMD or another one. They're simply asking Alexa or they're asking Siri, what could the signs be of strep throat? Or they're going to Chat GPT. And I'm concerned about the potential for misinformation. Where are these uh, programs getting their data? Where are they getting the information? What were they trained on? We also know there's a large number of folks, especially younger generation, that are simply listening to influencers on TikTok and Instagram. And how do we know that they're giving good information? So there is a real concern for misinformation and where
Mhm.
people are relying upon important information relating to their health and they need to, be a little more investigative in terms of is this information correct?
I think you actually cited a stat in your presentation today that like 79% of people, yeah, prefer the chatbot
Absolutely.
than a Google search.
Yeah, seems so much easier, isn't it? You don't have to take out your phone. It's more natural, as if you're asking a question. And these chatbots are improving every 6 months. It used to be every year, every 2 years.
Mhm.
It's every 6 months. And it seems like a natural conversation that you're having with these. So, sure, that seems preferred if you don't have to type something in. But I always liked to type it in to kind of see what else was being asked and to look around and double check sources where in these type of generative AI or chatbots, you're getting one answer and that's it. And sometimes it's right and sometimes it's not.
I was telling the story, to the masterminds team that my daughter-in-law, she was having a sinus infection. She used the chatbot to see if she was taking the right drug
Hmm.
because she wasn't convinced she was getting any better. So the chatbot, gave her
Hmm.
a different idea about what she should be taking, which then caused a reaction from me because I said, "Oh well, your doctor knows better than the chatbot." So, but this whole AI thing in healthcare is generational too, isn't it?
Absolutely.
There's a big difference in how, different generations are using and accepting AI in healthcare.
Very much so, especially younger generations are more prone to use these AI tools. They're more willing to give up their personal information to get some type of content. And healthcare is going to look very different 10 years from now, I would argue, in terms of even going to the doctor's office. People want to be able to be their own doctor to some degree to save time because as we talked about, it can take a while to get an appointment with a doctor. And most of the time, you don't want to wait. You're concerned about something. So if you could get an answer sooner, that can be better. But my approach is often, and when I still see patients, I want them to bring that information to me, right? So for your daughter,
That's great.
I want to have that dialogue and have that conversation. And that's where AI, augmented intelligence,
Mhm.
can help promote dialogue to get better care.
Mhm. Right. Well, yeah, I'm glad that you said that because I think a lot of people are scared to talk to their doctor about stuff they find when they Google it or chat about it, right? They're like, "What was the doctor going to get offended?" Right?
That's generational too, I'll tell
That's
you,
I
Curran.
think that's me, right? I think I do. I think
Yeah.
that's just
The younger
part of the
generation is
generation.
not fearful of telling me that they think I'm wrong,
Yeah, yeah.
and that's okay because that can promote a healthy dialogue. I like it when people come prepared for the visit
That's
and
great.
tell me what they're thinking or what they're concerned
Hell.
about because that's gonna give them a better visit.
Well, you told us in the talk today that there's 1 billion hits a day on health
A
related topics.
billion hits on Google just on health, right? So people are querying about health concerns. That's going to change, Craig, with all these other tools that we have. But people are very interested in health, and that's a good thing. They want to take control of their own health.
Right. So just think about that, right? The billion hits on Google, that's doesn't even include all the other tools that are out there that people are searching, right?
That's exactly right.
Whether it's WebMD or using TikTok or
Yep.
whatever. You also cited that TikTok is becoming a significant use for health-related matters.
Absolutely. It's one of the top sources of content, health information. And the challenge is, the measure that people are using is how many followers they have in terms of the credibility of the information. And I'm not sure that's the right metric. We wouldn't do that for our financial information. We wouldn't just, listen to the person that had the most hits. We would kind of do our own research. We would try to corroborate the information. We'd ask experts that we know about it. And that's how we have to think about our health as well.
So, one of the things that we are always very good with in the medical system anymore is privacy of our health information. So, how do you view privacy related to the use of AI?
Yeah. So we really have to rethink about this concept of HIPAA, the rule that relates around portability and privacy. I won't go into all those details, but that's not really set up for how we're designed today in
Right.
terms of providing information. So I'm concerned a lot about the data breaches that are occurring. Where is this information going? Many of these tools, depending upon who's utilizing them, they don't come under the covered entity issue that HIPAA applies to, so you don't have as much protection about your data. Is your data being sold in terms of the information that you're giving? So we really have to have more transparency in terms of how these tools are utilizing data. Our health is our most private information, and we really should be protective of that.
Well, thank you for the conversation,
Well,
Dr.
thank you,
White.
Craig.
Dr. White is Chief Medical Officer at WebMD and soon to be CEO at the American Medical Association. And we so appreciate him
Thank you.
being part of Nosco's family of trusted advisors and working with us and for his conference talk today. So um, until we meet again, many blessings and thank you.
Indeed. Thank you.